Good afternoon, and welcome to Seven Things to Know About Practicing Medicine in Texas, Part 2. I'm Kathy Bryant, and I will be your host for today. Just a couple of housekeeping tips before we actually we start the program. The TMLT has designated this live activity for one credit of I'm sorry, for one AMA Category 1 credit. Physicians should claim only the credit commensurate to the extent of their participation. The one credit has been designated in medical ethics and or professional responsibility. A link to the evaluation for the program will be emailed to you within 24 hours. CME certificates will be emailed to you within 10 days. We have included, in addition to a copy of the presentation slides, a number of helpful resources that you may want to download. They're in the Files pod in the lower left-hand corner, and you can download either one individual document or you can download all of them by clicking on the three dots and download all. We encourage you to ask questions throughout the program using the Q&A pod below the slide presentation. And if you have questions, you certainly can uh, type those and we'll get to questions as we can at the end of the program. It is my pleasure to introduce to you Cassie Turner. Cassie is the manager of TMLT's Risk Management Department. Cassie is going to talk about the last parts of the seven things that we want you to know about practicing medicine in Texas. As we talked about the last time we did part one, that even though you may not be a new physician practicing in Texas, these may be helpful things as you bring on new staff and try to get them acclimated to practicing in Texas. At this time, I'm going to turn it over to Cassie. And Cassie, take it away.
Perfect. Thank you, Kathy, and thank you all for joining us today as we are doing part two, as Kathy mentioned, of our series, Seven Things to Know About Practicing Medicine in Texas. If you weren't able to join us, as Kathy mentioned, for part one, that is available on our hub. We discuss topics like medical records, treatment of minors, and the Texas Prescription Monitoring Program. And so, as most of you know, there are a lot of rules, probably thousands of them, that regulate and govern the practice of medicine in Texas. And we've just found that there are some that can be a little bit of a tripping point or a trouble, especially if new to Texas. So, today we're going to continue our discussion and talk about some additional topics that can be a little challenging. Informed consent is one of those topics, medical spa regulations, physician advertising, and leaving a practice, as you can see here. So, again, as Kathy mentioned, if you're not a physician or you're a non physician or an admin, these resources may be helpful to you for onboarding or if you have a practice in service or something along those lines. But we hope that you find them helpful to you today, regardless of where area of the practice you're serving in. So, informed consent in Texas is governed by statute and is overseen by the Texas Medical Disclosure Panel. This panel generally includes six physicians and three attorneys, and they review all the treatments and determine which procedures require informed consent and which procedures do not. They categorize these into two basic categories called List A, and those are procedures that are requiring disclosure, and List B are procedures that do not require a disclosure. This was first published back in the early 80s and became official and has been effective and in place since I think right around 1982. So, which require consent and which procedures do not? We have included the link here to the Texas Medical Disclosure Panel because these can change at times. And so we want to make sure you have the link so you can visit it if you're doing procedures and need to review those. As mentioned, there are two lists. List A, and that is the list that they have delineated and put certain risks for certain procedures. So, if you're doing a procedure for a patient that is on list A and you're doing an informed consent, you'll want to be sure to include the elements that they require for that particular procedure. And those are generally expected to be done in writing. Those that do not require a specific disclosure, there's a list B, and you can see those there as well on that website that we've listed. Um, but they don't require a written per se informed consent form. So, as I mentioned, they will periodically review these and they'll add new treatments and procedures. I think they reviewed a lot of them in 2020, and there were a lot of new forms that were put forward. There was some new language in these. So, again, if you're doing procedures, just recommend that you check this website routinely to make sure that you're capturing the most current risk that are supposed to be disclosed to the patient. The website also has forms that are available for you to download. Most of them are in Spanish and English, and some forms are specific to specific procedures. For example, there's one for radiation therapy, there's a specific one for hysterectomy, there's specific forms for anesthesia, and you can download those from that website that we include here for you. So again, if it's on the list A, you want to follow what they've required. If there's a procedure that's not on list A or B, then our recommendation is the physician disclose all material and any inherent risk that could influence a patient making a decision about that procedure. So physicians must obtain consent, and this was a little bit of the language that they edited or emphasized more in 2020. Just the duty of the physician performing a procedure to obtain the informed consent. So sometimes we see in past years that this is done in a hospital or a surgery setting, and perhaps someone other than the physician performing the procedure is doing this consent. The language now is stating that it is the duty of the physician, and that should be done by that provider, and it cannot be delegated to someone else. Um, Again, we would recommend that these would be done in the office when available, at a pre-op visit or something like that, if it's an opportune time to do it. Sometimes we know that that's not a way to get it. You have to do it real quick procedure. So we do recommend giving the patient time. So, doing it at that pre op visit when available gives them adequate time to consider the risk benefits of the procedure and make an informed decision. So, what should be included in the discussion with your patient? It should include the patient's condition, the procedure being performed or suggested, risk and potential complications of the procedure, benefits, and alternatives, as we've mentioned. Again, there should be adequate time for the patient to ask questions and the physician to respond to all of those questions as accurately possible. There's no definition for adequate, so that's one of using your best judgment of giving the patient time to ask questions and time to make an informed decision. By statute, the Texas Medical Disclosure Panel may not require disclosure of risk of certain surgeries. So, again, best to disclose those risks that you feel are reasonable that the patient would want to know when they're making their decision to move forward with a procedure or not. So again, we have included some resources for you on informed consent in the files pod down on the left corner there that Kathy mentioned. You can download those there for review. So jumping into telemedicine real quick, I know a lot of practices have shifted to using telemedicine, and there have been some new rules and regulations around telemedicine specific to Texas. So, a couple of things that we're just going to mention is verifying the patient's identity, notice of patient privacy, telemedicine consent being obtained, and Texas Medical Board complaint process. So, if you don't have a process for verifying your patient's identity if they're doing a telemedicine visit, we recommend that you develop some identifiers that are reasonable for those telemedicine or audio visits that you have as an established protocol within your practice. I would recommend just going ahead and making it a written policy and procedure that you have in place so that you can know how to, all your staff knows how to verify a patient's identity. Notice of patient privacy are also important as a part of complying with federal and state privacy and security requirements. Physicians are required to provide a notice of patient privacy in accordance with the law and make a good faith effort to obtain the patient's written or electronic acknowledgement of the notice. And these things are should be done before the telemedicine visits occur. So before any telemedicine visits are offered or engaged in, these elements need to be met so that you're in compliance with what federal and Texas law are asking. So here is a sample, and we include the link to this form. If you do not have a written consent form for your office, you can find some samples out on the web. On here is one from TMA. You do need to obtain this again before your telemedicine visit. Obtaining these from your patients. You can do this by posting it on their website, pushing it through the portal. There are a couple of different ways that you can provide this to the patient prior to their appointment. So, in addition to obtaining informed consent, Texas regulations also impose a specific requirement for telemedicine regarding the board complaints for the Texas Medical Board. So you must provide this notice to the patient again prior to their appointment, and it can be posted on your website. It could be included in a mailer that you're sending to the patient. You can also try to put it through to the portal. The one thing that you'll want to keep in mind is the notice has to be in at least 10-point font that's easily readable, and it must contain exactly the text that the Texas Medical Board rules provide for the notice. And again, we have the notice here for you, and there's also a link that you can access it. And I believe we also have a downloadable version of this in the files pod for you. So, telemedicine outside of the state of Texas, this is a whole other topic, but we'll just mention briefly that as a general recommendation rule, you'll want to know the rules and regulations of the state that your patient is in. Generally, licensure is required within that state, but you will want to check before offering services to a patient who is out of state. Um, and also, I'll just mention that last week the OCR issued some telehealth privacy and security tips for patients. It's just a resource that they're offering that came out of the Government Accountability Office to help providers educate and explain to their patients in plain language about privacy and security risk involved with telehealth visits or remote communication. Again, they're just tools and resources for you that are out there as a recommendation or a resource. They're not a requirement that you educate the patients, but if you're interested in those or you need those, you can Google the OCR website or shoot us an email and we'll send those over to you. So, shifting gears here a little bit, we're just going to briefly touch on med spas in the state of Texas, since there are quite a few medical board rules that are around these. So, physicians who delegate duties are generally vicariously liable for the activities performed by a staff member. So, we do see some cases that are been involved with performing procedures that have not had a good outcome. The board, Texas Medical Board, has established guidelines for all non-surgical medical cosmetic procedures to be performed by a qualified non-physician. These procedures, as you know, will include injections or the use of prescription medical devices. And if you're someone who's wanting to offer these med spa services, we would really recommend reviewing the rules and regulations of the Texas Medical Board. It's Chapter 193.17, and reviewing those in full. There are a couple of tidbits that I'll just mention that these procedures must be performed while a physician or a other advanced practice provider is either on site or available should an emergency happen. And these appointments generally should follow the same as you would for a regular clinical appointment with a patient for another a non cosmetic issue, obtaining a history, performing an exam, appropriate diagnosis and treatment, a very detailed written treatment plan. Informed consent should be obtained. Emergency and follow up care instructions, signed written protocols should be in place, and standing orders that are signed and dated should also be in place. And again, just as a reminder for physicians that it's somewhat their duty to ensure that the individuals performing those procedures have the techniques for those procedures. They understand procedural indications, contraindications, pre procedural and post procedural care, recognizing acute management of potential complications and infectious disease. So it's pretty in depth and pretty detailed. So we just mentioned it at a high level. Again, if you're going to do med spa offerings, become very familiar with Chapter 193.17 of the Texas Medical Board rules. Because again, in the state of Texas, it is the physician's responsibility, regardless of who performs the procedure. The supervising physician is responsible for the safety of the patient in all aspects of that procedure. And finally, I will just mention before moving on to physician advertising is ensuring good documentation. This, I know you guys hear us talk about document all the time, but making sure that all of those procedures are documented well, and that if you're the physician overseeing those, that you have reviewed those, and is a good recommendation to make sure that all of the things that are needed to be happening are happening for those visits. So, as with med spa physician advertising, there are some specific rules to the state of Texas. Physicians who are planning to advertise, either if you're doing it on your website or through a community sponsorship or a billboard, types of charity events, you want to become familiar with the rules for physician advertising. We would definitely caution on advertising a professional level of superiority for performance of a procedure or treatment type. Um, and just being aware that anything that you advertise must be subject to verification. So that's kind of the key takeaway here with advertising, is that it needs to be able to be readily verified by facts. If you can't readily make a fact about it, then it's probably something that you want to be very cautious with advertising. There are actually two separate entities that enforce statutory and regulatory restrictions on physician advertising. So you have the Health Professions Council, which is a state agency, and you also have the Texas Medical Board. And then the Texas Attorney General is also granted authority to file an injunction and seek penalties for a violation of these physician advertising rules. So again, you want to make sure that you're following what the TMB would like, and that they're not enforcing any prohibitions upon you. One of the primary ones is around deceptive advertising. So you don't want to advertise any false, deceptive, or misleading statements. Again, anything that's stating superiority or something that cannot be readily verified with facts is something to avoid. A statement about the physician's professional experience, competence, or quality should only be made if it can be supported, as I've mentioned, by facts. There are some terms that you can use. Board certified, you're authorized to use this. And any advertisement only of the specialty board that conferred the certification and is a member of the American Board of Medical Specialties. So you'll want to check that out. And you may advertise certification by other types of organizations only if the organization meets certain criteria as specified by the TMB advertising rules. Kind of goes along with board eligible. The rules expressly prohibit this. Board qualified in physician advertising. The board determined that these terms are a bit misleading and confusing, so they encourage you to not use them and to avoid them. The Chapter 164.4 of these rules has quite an extensive list of what is permissible. So, if you want to advertise, I would recommend looking at the list. Again, it's pretty extensive and robust, that can guide you as you're going through your advertising or marketing activities and coming up with a plan. You can follow those recommendations and that list of permissible advertisements to make sure that you're in alignment with what the board is asking of you. And then finally, our last topic, I know I'm kind of breezing through here pretty quickly, is leaving a practice. This is a very common consult that we get in our risk management department. It's always one of our top consults that we get. So, if you're planning to leave a medical practice or retire, something along those lines, there are certain things that the Texas Medical Board requires of you as you're leaving, closing, or selling your practice. Those are outlined for you in Chapter 165 of the Texas Medical Board. And I apologize, I'm giving you so many references to so many board rules today, but we wanted to make sure that you had those just so you can look at them because they are quite extensive. Um, so when you retire or terminate employment, these are the things that you will want to be working on. Ensuring that patients receive a reasonable notification, ensuring that patients are given an opportunity to obtain copies of their medical records or arrange for the transfer of their medical records to another physician or provider. You'll also want to notify the Texas Medical Board when you are terminating practice, retiring, relocating, or will no longer be available to patients. You'll want to specify who has custodianship of medical records and advise how copies of the medical records may be obtained. So that's what you'll want to provide to the patients directly. You'll also be responsible for some other notification. One of those is posting a notice in the physician's office or on their practice website, or publishing a notice in the newspaper of the greatest general circulation in each county in which the physician practices or practiced, and in a local newspaper that serves the immediate practice area. So there's an either or there, and we get a lot of questions about that one. So um, that's why we give you the rule as well, so you can take a further look at it. And placing the written notice in the physician's office and notifying patients seen in the last 2 years of the physician's discontinuance. So anybody seen within the past 2 years is the bulk of who you're going to want to notify. And you're going to want to notify them by either sending a letter or sending an email to each patient in a manner that is compliant with state and federal law. So those are all the requirements of notification and what must be posted and where it must be posted. Additionally, a copy of these postings are submitted to the TMB within 30 days from the date of termination, sell, or relocation of the practice. And notices placed in the physician's office shall be placed in a area that's easy for patients to identify, and that they can see very easily. It must be placed at least 30 days prior to the termination, sale, or relocation, just somewhere in the office where it's easy for the patients to see that visually. So, leaving a group, if a physician is departing a group, the departing physician is responsible for providing proper notification. This is one we get quite a bit. If someone's leaving, they want to know what is their responsibility. Oftentimes, seems as though it is the responsibility of the practice, but it's actually the departing physician who must do the notifications. And they can work in line with their practice if their practice is willing, but it ultimately, the departing physician will notify the TMB as well as their patients and advise them on the custodianship of their medical records and if the copies will be maintained at that office or somewhere else. Um, those remaining in the practice, the other providers that are there, administrators, are not to interfere with the departing physician fulfilling these responsibilities. The TMB has rules prohibiting the practice or the physician group from interfering with these types of notifications. So we have heard of times where physicians weren't allowed to put their posting in the office, or they weren't allowed to be able to get address information or contact information of their patient. So, if you do have a departing physician, you'll want to make sure that you don't prohibit in any way. The rule is here, Chapter 165.5, um, not preventing the posting of the sign. So, when requested, the practice should provide the departing physician the contact information of his or her patients. We get this question a lot. Sometimes the practice isn't sure if they should release that information as far as the contact, but if the departing physician does request it, then it's helpful to go ahead and provide that to them to avoid any TMB or Texas Medical Board disciplinary sanctions uh, to the practice for interfering or in any way. So that was very quick that I went through that. I do see that we have some questions and we anticipated that we would. So we wanted to leave a little bit of time for questions. So if you have any questions that you would like to place in the Q&A pod, please go ahead and do those at this time and we will take them. And just as you're doing that, I'll just mention, as Kathy mentioned, you will get an evaluation after the webinar, and I'll launch that here in a bit. You'll get your CME certificate in about 10 business days, and you'll also get a recording to this presentation for today.
Hey, Cassie, I just wanted to mention that we're getting feedback from some participants that the webinar is either freezing, uh, or they're having difficulty hearing the webinar.
Okay.
Um, if I could just ask if you've been able to view the webinar and hear the webinar, if you would just put yes I can in the Q&A pod real quickly. We're trying to troubleshoot it on the back end. Also, um, we will work to get the webinar or the recording out just as soon as we possibly can this afternoon, after we have verified that it has in fact recorded. And I apologize if you were one of those having trouble. Um, Again, sometimes technology does not play nice in the sandbox. So thank you all for replying that you could hear the webinar. So Cassie, one of the questions I have is that I'm part of a large multi-specialty clinic. When I leave the practice, the organization says they will be responsible for all the notifications. Is that correct? And I have nothing to do?
No, the departing physician does have a lot of onus in the process. If you're departing and your group is willing to assist you, that's fantastic. However, you will want to ensure that it is actually being done. And we've seen where departing physicians have relied on their group to do the mail outs and then come to find the mail outs were never sent out, or the emails were never sent out, or to the portal notification. So I would definitely be very hands on if you're the departing physician. Work with your group in tandem, but just also, verify that those things are being done that are required by the Texas Medical Board, because at the end of the day, they do hold the departing physician responsible for making those notifications and checking off those boxes of their requirements.
Let's see. Um, a, a physician is asking, they plan to retire at the end of the year and they're still using paper records. Their plan is to give the original records to the patients that they see in December. Is there a problem with this plan?
Generally, our recommendation is, and Kathy, you are one of our HIPAA and medical record retention experts, so you feel free to chime in as well, that those originals are kept by the provider and not given directly to the patient, just because you are required to maintain those for at least, there's some different rules, 7 years for adults. Minors, there's a little bit different rules around retaining those records. So you will want to not get rid of the original and not have a backup of the copy of those records.
I agree, Cassie. We covered this fairly extensively in part one, but part of the issue is that you're still potentially, you could be sued, you could have billing audits by insurers or Medicare or Medicaid. And so you need to have your records to defend yourself, basically. If you don't want to keep paper records, you could go through the process of scanning them, as long as you felt certain that the scanned copies would be available to you when if you needed to access them. Um, but yes, we don't really advise destroying or giving the original record away.
Right.
Let's see, couple more. I always document RBA explained on patients going to surgery. Uh, is that adequate?
Um, we do see this a lot, and I know that it sometimes is a function of templates and getting that into the record. I think it's best to document as much specific information as you are able to, and certainly what was discussed with the patient reflected at that date of service or that pre-op appointment. Again, the more that you can put into the note, the better. And certainly, if it's a list A procedure, then you'll want to make sure that you're including in that consent form, let's say you make your own form, you'll want to make sure that you're disclosing the risks that are identified by the Texas Medical Disclosure Panel in your written consent form. If it's a procedure that doesn't require specifics, I would put the ones that are reasonably expected. That the patient would want to know about that you have discussed with them. I think it just gives you a little bit more, you know, detail that could be helpful in any type of claim or complaint situation. Also, just managing patient expectations. Sometimes, if it's a particularly cosmetic procedure, there may be some risk that they feel or some things that weren't disclosed to them. But if you have that in the note, I think it just helps you down the line.
Great. Um, you mentioned that physicians can develop their own forms for informed consent. There's a question about a physician who does uh, m- a lot of cataract surgery and they want to make their own form with large print to make it easier for their patients to read. Any
Sure.
suggestions with that?
I think the as long as the form contains what the Texas Medical Disclosure Panel is asking, then the form can be edited somewhat. And Kathy, you may know differently than me, but that's um, the real thing is that it has what the Texas Medical Disclosure Panel is listing as the risks that need to be disclosed to the patient.
Absolutely. It does not have to be the exact sample form that the state does have on
R-
the disclosure panel website.
Right. And there may have been a bit of confusion because there was one form that I mentioned that does need to be a 10-point font and have the exact language of the TMB. So that's a totally different form from the consent form that we were referencing. That was the telemedicine form.
Great. Thanks, Cassie. Let's see. I'm looking through a couple of the the rest of the Q&A panel. Again, if there is ever um, something that comes up that you think of after the webinar, you can always email cyber@TMLT and we'll get that question either answered for you or to the person that can hopefully provide that answer for you. There's a CME question. I'll pass that on to our CME folks and let them uh, make sure they get an answer to the about the CME specific question for this. Any other questions before we wrap up for the day?
I think one
I
question that I did see, Kathy, that I'll just mention, or that we get often, that I'll just address briefly, is I mentioned email for obtaining and consent for telemedicine. It is okay to obtain that via email, but just you want to make sure that the patient is requesting that. You don't want to create a burden for them. If you can push it to the portal, that's ideal, as I mentioned, but making sure that you just document, I just wanted to clarify that you document that the patient consented to receiving that information via email, that they requested it, they understood their risk, and that's how they would like to receive it. And I think that would be just a helpful from a HIPAA perspective to meet those rules and regulations and recommendations.
Thanks. That's a good question. I would just remind you that I can't believe that it's almost the end of October. There is not a webinar scheduled for November because it would fall Thanksgiving, uh, right around the Thanksgiving holiday. And so we will be doing a webinar in early December. We look forward to having some a guest um, presenter at that time, and we'll be getting that information out very soon. If there are no other questions, I will wrap it up. And again, thank you all for attending. And if you were one that had issues with the recording, I'm sorry, not the recording, but with either logging in or being able to see or hear the webinar, our apologies for that. Any last thoughts, Cassie?
No, thank you guys so much for taking time to join us today. And we hope that you have a good remainder of your week.
Thanks. Have a good day.
Thank you.